Assalamu alaikum sir, I am Riyaz Hussain. My ID 181290449. My presentation topic rational use of drug. Definition of rational use of drug. In simplest word, rational use means prescribing right drug in adequate dose for the sufficient duration and appropriate to the clinical need of the patient at the lowest cost. World Health Organization, the rational use of drug require that patient receive medication appropriate to their clinical need in dose that meet their own individual requirement for an adequate period of time and at the lowest cost to them and their community. Criteria for using medication: appropriate indication, appropriate drug, affordable, appropriate administration dose and duration, appropriate patient information, reason for irrational use of drug, lack of information, lack of diagnosis facility, demand for the patient load, promotional activity of pharmaceutical industry, defective drug supply system and ineffective drug regulation, absolutely irrational use, injudicious use of antimicrobial antibiotic in viral fever and diarrhea, unnecessary combination, use of drug not released to diagnosis, incorrect route, incorrect dosing, under or overdose, incorrect duration, prolonged or short-term use, unsafe use of corticosteroid, hazard of irrational use, ineffective and unsafe treatment, over-treatment of mild illness, inadequate treatment of serious illness, prolongation of illness, increase adverse drug event, increase morbidity and mortality. Step of rational use. Step 1. Identify the patient problem based on symptom and recognize the need of action. Step 2. Diagnosis of the disease. Define the diagnosis. Step 3. List possible intervention or treatment. Identify the drug. Step 4. Start the treatment by writing an accurate, complete prescription. Step 5. Give proper information, instruction, and warning regarding the treatment give. Step 6. Monitor the treatment to check. Conclusion. Drug use in usually the end of therapeutic conclusion. Ensure that the correct drug is given to the correct patient is a high priority for all health professionals. We all have a duty and responsibility to the public to ensure that the right drug is prescribed. That's all of my presentation.